In that we have studied till now cholinergic drugs, that is acetylcholine drugs, anticholinergic, that is anti-muscarinic, and anti-nicotinic drugs. Okay, we have studied complete information regarding parasympathetic nervous system. The neurotransmitter in parasympathetic nervous system is acetylcholine. It is interacting with muscarinic nicotinic receptor. Then here we have seen direct acting, indirect acting. Indirect acting means cholinesterase enzyme inhibitors. Cholinesterase enzyme inhibitors that we have seen. Each and every one drug we have taken. Then anti-muscarinic drugs we have seen. So they are mainly used to relieve pain, stomach pain, smooth muscle pain, bladder pain, colics, gallbladder stone pain, that they relieve. Profanthalline. Examples of drugs are profanthalline, atropine, benzatropine, homatropine, mebaverine. They're used for irritant bowel syndrome, that we have seen. Then nicotinic drugs, anti-nicotinic drugs we have seen. Anti-nicotinic drugs we have seen, that is D-tubocurarine, pancronium, succinylcholine. They are mainly used for skeletal muscle relaxation purpose. Today, we will study about autonomic nervous system. Same autonomic nervous system, but sympathetic drugs. Okay. They are called as, previous drugs were called as parasympathomimetics. Parasympathomimetics. Here, the same fashion, they're called as sympathomimetics. Sympathomimetics. Two names. Two words are present. Sympathetic, mimetics. Mimic. I told you what do you mean by mimic. Imitation. Otherwise called as adrenergic drugs. Otherwise called as adrenergic drugs. They're also called as sympathomimetic amines. Sympathomimetic amines, because all these drugs have amine group in its structure. All the drugs contain amine group in its structure. Hence, they are called, they're also called as sympathomimetic amines. Now, what do you mean by this? Sympathomimetics are drugs which mimic the responses obtained as a result of stimulation of sympathetic nervous system. So whatever responses you get when sympathomimetics nervous system gets activated, the same responses you get when the drugs are taken. That's why they're called as sympathomimetics. Mimetics means imitating, mimicking. See, now they're also called as adrenergic agonists because they interact with adrenergic receptors and produce action. Adrenergic action. What action? Adrenergic action. Complete opposite actions you get. You get complete opposite to parasympathomimetic action. Parasympathomimetic action. Now, biosynthesis. What are the neurotransmitters? Dopamine, noradrenaline, and adrenaline. These are the neurotransmitters present in parasympathetic nervous system. We will learn more specifically. Now, the In the biosynthesis of adrenaline, there are various steps. And that is tyrosine is the starting amino acid required. What is the stereoisomerism of amino acids in our body? Our active amino acids are levorotatory. All amino acids are levorotatory in nature. Levorotatory in nature. That's why you can see anywhere in our textbooks L amino acids, L tyrosine, or L histamine, histidine, L arginine, L histamine, like that they will be presented. So there are D type of amino acids which are produced in microorganisms, bacteria, or whenever you synthesize amino acids in the laboratory, you get D type of amino acids. Humans use levorotatory amino acids. D types of amino acids are present in microorganisms, and when you synthesize in the laboratory, you get D type of amino acids. So all the amino acids, whatever we are telling, it is L-tyrosine. So ultimately you get L-adrenaline, L-noradrenaline, L-dopamine, all are L-dopa. All are levorotatory in nature. Levorotatory in nature. So let us see what is the biosynthesis of adrenaline, noradrenaline, dopamine. The starting material is tyrosine. Now, tyrosine, you can see it in tyrosine hydroxylase. What is the enzyme? You see tyrosine hydroxylase. So the function of this enzyme is addition of one hydroxyl group. So new hydroxyl group is added. Then it is called as dopa, L-dopa. We have seen this in Parkinsonism disease. L-dopa. Dihydroxy, dopa means what? Dihydroxy 2-hydroxy phenylalanine. This is amino acid phenyl. So this is phenyl group, alanine group. This is alanine group. Which one? This is alanine group. See, 2-hydroxyl group are present. Dihydroxy phenyl alanine. This is an L-dopa. Now L-dopa, what happens is that when it comes in contact with dopa decarboxylase, then what happens is that the carboxylic group is removed. Carboxylic group is removed with the loss of carbon dioxide. This H, when carbon dioxide is removed, there is carboxylic group COO2. It is COO goes as CO2. This H will automatically attach to this carbon. So that's why you see CH2, already CH2 is there. Now CH2, NH2. It is called as dopamine. This is the neurotransmitter which plays very, very important role in Parkinsonism. In the brain, it produces L-dopamine is produced. Even L-dopamine is also produced in kidney. Very important function in the kidney. Now, dopamine, with the help of dopamine hydroxylase, you see again hydroxylase enzyme. What happens is that now hydroxyl group will be produced, will be in the side chain at the alpha carbon. Noradrenaline, this is, you see, new hydroxyl group is synthesized. Noradrenaline. Now N-methyl transferase. By the help of enzyme N-methyl transferase, methyl group is attached, which resulted in adrenaline. So this is the biosynthesis of adrenaline. Now, so what is the actions of adrenaline? Whenever you see a snake, whatever the activities occur in our body, activities that are produced in our body are nothing but actions due to sympathetic nervous system or due to release of adrenaline. Another name for adrenaline is epinephrine. I think epinephrine. It is the same one. Adrenaline. Adrenaline is British pharmacopoeia. It is mentioned with the name of British pharmacopoeia. Epinephrine. Epinephrine is in USP, United States pharmacopoeia. That is only difference. Adrenaline, epinephrine. Here also, noradrenaline, norepinephrine. Norepinephrine. It's the same name. Both are same. The structure, chemical, everything, and it's also synonym. One is donated by USP, one is mentioned in British pharmacopoeia. Pharmacopoeia. Now, so when you see a snake, what happens to heart rate? Increases. Blood pressure is increased. Blood pressure is increased. So if you block adrenaline synthesis, if you block adrenaline synthesis, what happens? There is decreased blood pressure. There is one drug which is acting in this fashion, and that is used in treatment of hypertension, is methyl tyrosine. You can see it, the negative symbol, what I am donated here, what I represented here, indicates that this drug is able to block this conversion of tyrosine to L-tyrosine to L-dopa is rate limiting step. Rate limiting step. That means this enzyme is necessary for conversion of tyrosine to dopa. It cannot be hydrolyzed by, see, dopamine hydroxylase cannot hydrolyze tyrosine to dopa. It is specific. Our drug, methyl tyrosine. Anyhow, we are going to study about cardiovascular drugs. Next, you can remember that methyl tyrosine. What is structure and everything we will study in coming classes. This methyl tyrosine is a drug which can stop this rate limiting step and used in treatment of hypertension. Then there is one more drug, carbidopa, which can stop this process. Carbidopa is used as an adjuvant drug in Parkinsonism disease. In Parkinson disease, that prevents conversion of dopa to dopamine peripherally. Peripherally. We learned that last semester. Refer that. These are the two drugs which are involved in the which can block the synthesis of adrenaline. Here what happens is that carbidopa is not used in as an antihypertensive drug. It can only prevent conversion of dopa to dopamine peripherally in Parkinson disease. Otherwise, this drug is not an antihypertensive drug. Now, I am telling here, dopa decarboxylase is not a rate limiting step. There are some decarboxylase enzyme that can also remove carboxylic group here, the carboxylic group present here. Rate limiting step means it needs this enzyme specifically. Needs this enzyme specifically. I think you might have learned in biochemistry all this. Please refer to that. Now, these are the changes. I made animation. You can see it. And this is a new change. What it happened. Next, this is the new change because of decarboxylation by decarboxylation process. New hydroxyl group is formed. New methyl group is formed. New methyl group is formed. N-methyl transferase is nothing but one carbon atom metabolism. One carbon metabolism. You might have studied in biochemistry. You referred that methyl transferase. Methyl transferase. Now let me go for metabolism. Now this drug. Oh my God. So sorry. Okay. Now we have taken norepinephrine. Now you can see it. We have taken norepinephrine. Let me take different color. Norepinephrine. Norepinephrine means noradrenaline. Why not? There is no methyl group. Methyl group. Nor means without methyl group. Without methyl group. Epinephrine is having methyl group. Epinephrine is having methyl group, whereas norepinephrine is not having methyl group. That is only difference between epinephrine and norepinephrine. Now, it can be acted by two enzymes. All the dopamine, dopamine, adrenaline, noradrenaline can be acted by these two enzymes, MOA enzyme, monoamino oxidase. We have studied this also. And one more enzyme is catechol orthomethyl transferase. Catechol means this ring. This is the ring which represents catechol. Benzene ring having two hydroxyl group in its structure adjacent to each other. Then it is called as catechol. Then it is called as catechol. Now you see the name catechol. Catechol methyl transferase. Methyl transferase. It transfers methyl group to the catechol ring, where to the orthohydroxyl group. So norepinephrine, when reacts with catechol orthomethyl transferase enzyme, you see, methyl group is added. When methyl group is added, what happens? It loses activity. We will study why it loses activity when it interacts with the receptor. You can now get some idea. We have studied last time drug interaction, drug receptor interaction. Both the hydroxyl group are able to form hydrogen bonding with the receptor. Now, when there is methyl group, that hydrogen bonding is not possible. That's why it loses activity. I'm explaining now itself. Orthomethyl transferase. You get metepinephrine or methyl norepinephrine. Methyl norepinephrine is this one. When it come in contact with MOA, monoamino oxidase enzyme, what happened? This group is removed. Amine group is removed. Amine group is removed. And this carbon becomes aldehyde group. It becomes aldehyde group. That also we studied in Parkinson disease. MAO inhibitors, MAO A, MAO B, we have seen that at MAO inhibitors. So what is the name you are getting here? 3,4-dihydroxy mandelic aldehyde. Mandelic aldehyde. This is mandelic aldehyde. Now, this aldehyde group can convert directly into carboxylic acid group, or it can convert to alcohol group. It can convert to alcohol. Simple reaction. If you can see the organic chemistry reactions, conversion of aldehydes, aldehydes can be reduced to alcohols, You see, this will become H, OH, reduction process, no? Aldehyde. So aldehyde group can be reduced to alcohol. Further, it can oxidize to carboxylic acids. Oxidation, loss of hydrogen, and addition of oxygen. Carboxylic acids. So directly, what happened? Aldehyde can convert to carboxylic acids, or by step it converts through formation of alcohols. That's what, in the same fashion, a similar replica, it occurs even in our body. When aldehyde group is converted to alcohol group, now what happens? It becomes glycerol functional group. This is called as glycerol group. Glycerol structure is this one: CH2 OH, glycol, sorry, not glycerol. Glycerol is trihydric alcohol. Now it is glycol structure. Now that's why what the name is 3,4-dihydroxy phenyl glycol. Now again, it can come in contact with catechol orthomethyl transferase. Why? Because both the methyl groups, both the hydroxyl groups are intact. And what happens is that norepinephrine can also be metabolized by MOA, I told. So there is no, it is not come in contact with comet. It is called as comet. In short, you can tell as comet, catechol orthomethyl transferase. Now it has come in contact with methyl transferase, catechol orthomethyl. So methyl group is attached here. So 3-methoxy, 4-hydroxy, 3-methoxy, 4-hydroxy phenyl glycol. It can form on. Now, let us take again. Now you can see it here. Directly aldehyde has converted to carboxylic acid. Now this portion is called as mandelic acid. This portion is called as mandelic acid. Mandelic acid. So 3,4-dihydroxy. So full name is called as mandelic acid. Mandelic acid. Now the mandelic acid can convert again by the help of comet to form 3-methoxy-4-hydroxy mandelic acid, which gets excreted. These two are the byproducts. Byproducts, uh, uh, end products of in the metabolism. At the same time, we told methyl norepinephrine. Methyl norepinephrine can also, here what happened, the methyl group is intact. Now it can be come in contact with MOA to form this product. That is nothing but a VMA. VMA. What is VMA? Aldehyde group. Oh my God. 3-methoxy, 4-hydroxy, vandalic aldehyde. Vandalic aldehyde can be formed. Then this again aldehyde group can convert again to alcohol group or carboxylic group. The same way, no, here also there is carboxylic group. It can convert, I told you, it can convert, aldehyde group can convert directly to carboxylic acid group, or by step. It is reduced, then again oxidized. Direct oxidation also it can occur. Alcohols can undergo direct oxidation to form carboxylic acid. Or first it can undergo reduction, then again oxidation, Same way here. It can undergo alcohol group or carboxylic group. So this is the metabolism. So it gets metabolized by MAO and catechol orthomethyl transferase. The end products after metabolism is 3-methoxy-4-hydroxyphenyl glycol, or 3-methoxy-4-hydroxy mandelic acid. So these are the end products. End products. If you take this drug or our urine, if they check, no, this metabolite will be present in our urine, because adrenaline is a hormone which is produced in our body daily. If our heart is functioning, this is the function of adrenaline. So any doubt, children? Any doubt, please? Any doubt? Okay then. Any doubt means you can ask. Okay. So this is the metabolism. And now, So what are the endogenous produced? Now you can see it. Where they are produced. So these are the three occurring transmitters present in our body. That is noradrenaline, where it is produced postganglionic sympathetic site. Postganglionic sympathetic site. Where is that postganglionic? No, you know the diagram and everything, I think. Postganglionic. Presympathetic, ganglionic, and postganglionic here. Here it is produced. Postganglionic sympathetic site. It is produced in every part except sweat gland, erectile pyroli, that is hair follicles. It is preferentially acts on alpha receptor. Noradrenaline acts at the alpha receptor. Now, adrenaline is secreted by adrenal medulla of adrenal gland, which is also called as suprarenal gland. Now, this adrenaline acts at alpha and both receptor, acts at alpha and beta receptor. Dopamine. It is a major transmitter in basal ganglia, CTZ, chemotrigger zone, limbic system, anterior pituitary, and renal vascular smooth muscles in kidney. That's what I was telling. It acts on dopamine receptor. Along with its action, it also acts at alpha receptor and beta adrenergic receptor. Both alpha adrenergic receptor it acts, beta adrenergic receptor it acts on. Which one? Dopamine. As well as dopamine receptor. It acts at the dopamine receptor also it acts. So these are endogenous catecholamines which are produced in our body. One slide. So what are adrenergic receptors? There are mainly two types, alpha and beta. Alpha receptor and beta receptor. They're subdivided into various types again. They're subdivided into various types. So now you can see it. Alpha 1, alpha 2, beta 1, beta 2. Now, at alpha 1, what's the neurotransmitter? Norepinephrine, epinephrine. Where they are present, blood vessels, kidney. What is action on blood vessel is vasoconstriction. Vasoconstriction. Action on kidney, decrease renin production. Renin production, relaxation. Intestinal smooth muscles, decrease motility. What happens? What's the action of acetylcholine? Increase the motility. Next, action on muscle, liver. Action on muscle and liver. It is glycogenolysis. Conversion of glycogen to glucose. You can observe. See, when you see the snake, will you stay there? You will run. When you want to run, you need to have some energy. So that energy you will get from the glucose. That's why all these adrenaline will increase glucose level in our body. Action on eye, blinking. Action on eye, blinking. Alpha 2 receptor, preganglionic nerve ending, vascular smooth muscles, pancreatic beta cells, and platelets. Platelets, it is present. Alpha 2 receptor. In platelet, it causes aggregation. In pancreatic beta cells, it inhibits insulin secretion. It inhibits increase insulin secretion. That's why it increases blood glucose level. Blood glucose level is increased. That's what I was telling. Here also you see glycolysis, conversion of glycogen to glucose. Vascular smooth muscles, that means blood vessels, vasoconstriction. Preganglionic nerve inhibit release of norepinephrine. See, alpha-2 receptors. When adrenaline or norepinephrine binds to alpha-2 receptors by negative feedback mechanism, it inhibits release of norepinephrine. Remember that, children. Students, you should remember this. It is like negative feedback mechanism. It is present in preganglionic. If this is ganglion, this is pre. The neurotransmitter, what is released in ganglion, if it attaches again at the alpha-2 receptor, which is present in preganglion, what happens? You get stoppage of norepinephrine. There are some antihypertensive drugs which are alpha-2 agonists. Alpha-2 agonists, which we have seen methylepinephrine. Just now we have seen in synthesis, no? In synthesis, that methyltyrosine, this is also alpha-2 agonist. Is also alpha-2 agonist. Remember that. Very important point. Alpha-2 agonists are antihypertensive drugs. Next, beta-1 is present in heart. You can see it, and alpha-1, alpha-2 are present in mostly in blood vessels. Blood vessels, vascular smooth muscles, blood vessels, platelets, you can see. Now, beta-1 is present in heart. What happens here, you see? Increase heart rate. Whenever you see a snake, what happens to your heart rate? Increase. Force of contraction, increase heart function, force of contraction. Ejection fraction is increased. Then automaticity, heart will increase its pumping ability. Automaticity is also increased. Rate of AV conduction from SA node to AV conduction is increased. Then beta-2 present. Beta-2. What is the neurotransmitter? Epinephrine. That is adrenaline. Beta-1 is also adrenaline only. Now, where do beta-2 receptors present? Bronchioles, blood vessels, GIT tract, liver, urinary bladder. Now, you see bronchioles, bronchodilators. Bronchodilators. If you can just recollect last class what we learned, ipratropium bromide plus salbutamol. It is used in treatment of asthma, we told. Ipratropium bromide is anticholinergic, so decrease secretions. And our drug salbutamol is bronchodilator. So asthma is relieved. That is called as bronchovent, we told trade name. Then blood vessels, vasodilation, GIT, decreased motility. Then liver, glycogenolysis. Then urinary bladder, relaxation of smooth muscles. Smooth muscles. Now, most of the times you get confused with beta-1 and beta-2 receptors. How many hearts we have? We have only one heart. We have only one heart. So that's why heart has beta-1 receptor. How many lungs we have? We have 2 lungs. So now the receptor what beta-2 represent 2 lungs, right lobe, left lobe. So beta-2 receptor is present in the lungs. You remember like that. Do not get confused. Beta-1, only one heart is present for us. So that's why it is present in heart. So these are the pharmacological actions, or normal actions are the alpha and beta receptors. Alpha and beta receptors. Now, how does it interact? How does it interact? So now this drug, what's the name of this drug or neurotransmitter? Methyl group is present. Check it. Methyl group is present. That is adrenaline. That is adrenaline. At physiological pH, what happens? Adrenaline can undergo ionization to form quaternary nitrogen. Quaternary nitrogen. This is the adrenergic receptor. Adrenergic receptor. This is amino acid. This is also one more amino acid. Different amino acids present here. Now you can observe what is the type of interactions. See, the hydroxyl catechol hydroxyl group can interact with amino acid serine 207, 207, and 204 by hydrogen bonding. Then you can see it. Now the quaternary nitrogen, because of ionization, it can form ionic bond with aspartate 113. Aspartate 113. Then the hydroxyl group can form hydrogen bonding with arginine 293. This is the interaction between adrenaline and its receptor. That's what I was telling. When adrenaline or noradrenaline, when it interacts with catechol orthomethyl transferase, what happens? This hydrogen will convert to methyl group. Now there is no hydrogen bonding. There is no hydrogen bonding. If this amine group comes in contact with monoamino oxidase enzyme, what happens? This amine group will be converted to aldehyde or carboxylic group. Aldehyde or carboxylic group. So when it converts to aldehyde carboxylic group, can it interact with ionic bonding? No. So that's why it loses its activity. That's why it loses its activity. So students, remember why this monoamino oxidase enzyme on metabolism, why it doesn't produce action. When there is when our drug or neurotransmitter, if it doesn't come in contact with comet, you can tell as comet or MOA, one more, and MOA, then it can form hydrogen bonding, ionic bonding, and hydrogen bonding, whatever required for interaction with the receptor to initiate intrinsic activity. Now, when it comes in contact with the enzymes, what happens is that there is no possibility, there is no structural functional groups which are necessary for interaction. Now, methyl group can hinder hydrogen bonding. Can hinder hydrogen bond. This is it. So, any doubt, please? Ibrahim?
Excuse me, sir.
Please, Brian.
Please repeat on how MAO hinders the process again.
MAO, good. Here, what we told, let me clear all. Or let us go one. Here, this is the amine group which is present in our drug or natural neurotransmitter. When it comes in contact with MAO, what happens? It is converting to aldehyde group. Aldehyde group. Now, aldehyde group can convert to carboxylic group or alcohol group or carboxylic group. Now you can see it at physiological pH. This amine group can get converted into ionized. When it forms ionization, it can interact with ionic bonding with the receptor. It is plus. Aspartate is having minus group, COO minus. So it can form ionic bonding with the receptor. Now when it converts to aldehyde group or carboxylic group, to alcohol group or carboxylic group, that ionization is not possible. See, this is carboxyl, aspartate is carboxylic group. Can it forms ionic bond? Both are minus n. Carboxylate is minus. And even this carboxylate is minus. Can it interact? No. Aldehyde? No. It cannot interact by hydrogen bonding. That's why when the drug is getting metabolized by MOA, it cannot produce action. Similarly, with the help of CAMAT. Here what happens? For example, serine, something we told, serine 204, something, 305 or something. It was having hydroxyl group, so it was forming hydrogen bonding. Now this H has converted to methyl group. Methyl group. So there is no chance of hydrogen bonding. No chance of hydrogen bonding. So it loses activity. Brian, okay now?
Yes, thank you.
Yeah, anyone please? Debru?
Yes.
Any doubt?
No doubt.
No doubt.
No.
Donald Ogolo?
No doubt.
Thank you. Evelyn?
No doubt.
Okay, all are present. Very good today. Kushi Patel?
No doubts.
Good, everyone is responding. Susan? I'm feeling happy suddenly, Susan. Okay, no problem. Iho?
No doubt.
Okay, thank you. So this is a this is the interactions. Hydrophobic interactions. This is how adrenaline is able to interact with adrenergic receptor. I didn't mention any whether it is alpha beta receptor. We will see later on that regarding adrenergic blockers. If you see, we will get the answer on. Now here itself it is there. Now you see here, you observe comparison of beta alpha adrenergic binding sites. Alpha adrenergic binding sites. Now you can see it. Adrenaline. Adrenaline. This is what is the structure? What is the structure? Please, can you someone tell? Let me ask. Kibandi. Kibandi. What is the structure? Your internet is not stable, madam. Can you repeat, please, again? Okay. Can anyone tell what she told me? Pooja Patel. Pooja,
Yes.
what is that structure which I have circled? What is this structure?
I'm not very sure of that.
I was telling adrenaline, noradrenaline. Now tell me what is the structure? When I'm asking questions, you people are leaving. Huh?
Noradrenaline,
Yeah, good. Why noradrenaline?
because of the presence of the NH3 group. There's a difference.
There is no methyl group. Nor means
Yeah, because-
lack of methyl
yeah.
groups. Very good.
Yes, that. Okay.
Sir, now students, you please listen. Difference between alpha-adrenergic receptor and beta receptor. Alpha-adrenergic receptor, see, it is able to interact with ionic bonding. Same way beta receptor, it is able to interact with hydrogen, with ionic bonding. But there is extra pocketed, which is hydrophobic in nature. That same hydrophobic pocket means space, is not present in alpha receptor. That's why, now please concentrate. If you have a methyl group or hydrophobic functional group that can interact with the beta receptor. This is very, very important. In SAR, we are getting. When there is no bulky groups, like you see here tertiary butyl group is present. Tertiary butyl group is present on the amine group. So that is able to interact with the beta receptor. I'm not telling whether it is agonist or antagonist. So whenever you have a bulky group, that is methyl group or nitrogen, it can interact with the beta receptor. Beta receptor. That's why adrenaline is able to interact with the beta receptors more. Or you just remember, whenever you have methyl group here, it can interact with the hydrophobic pocket. This is extra bonding. Remaining, you see, this is hydrogen bonding, ionic bonding, and van der Waal interactions. Everything is same for both. But there is extra hydrophobic pocket. Now you need to remember, beta receptors are two types, beta 1 and beta 2. Beta 1 is present in where? Heart. Beta 2 present in lungs. How many lobes are present in lungs? 2 lungs we have. That's why 2 beta 2. You can remember like that. We have only one heart. That is, I'm not asking chambers. We have only one heart. But 2 lungs, right lung, left lung. So that is present in heart. No. Remember that, we can see it further. Classification of drugs. Till now, whatever we studied, it is like introduction. We have already seen, what is that? we have already seen the structure, receptor, pocket, different how it is able to interact with the receptor, that all we have seen. So it is also part of our chemistry. Now classification of drugs. Excuse me. Direct acting, indirect acting, mixed acting. Same way like that. If it is acting on the receptors, direct acting, indirect acting, and mixed acting. Let us see. It has the basic structure. This is the basic structure. This is catechol ring. I'm telling again and again. This is catechol ring. Benzene having two hydroxyl group at side by side is called as catechol ring. Then ethylamine. Ethyl. So two carbons. Ethylamine. So this is the basic structure of catechol amines. Direct acting, acting at receptor. Drugs having catechol amine structure. There are two types again. Direct acting drugs are at the receptors. You see, catecholamines cannot be used orally. These drugs, no, the drugs having catechol cannot be used orally. Cannot cross blood-brain barrier. And these drugs have short half-life. Short half-life. These are the properties of catecholamines. What are the examples? You see, norepinephrine or noradrenaline. I placed it both again here. Epinephrine, adrenaline. Dopamine, isoproterenol is also called as isoprenaline. Dobutamine. Dobutamine. Next, non-catecholamines. Non-catechol. If you want catecholamines again regarding beta-1 agonist, dobutamine. All these are very fantastic drugs and they are life-saving drugs. Dobutamine. It is given 1 ml per minute or 1 ml per 10 minutes. So injection is given by robot. Slowly, there is separate instrument. Slowly, 10 ml throughout the day, it can be 10 ml injection. For 24 hours, it will be released into our body. For 24 hours, slowly it will be released. Whenever you are in final stages, we will use these drugs. Dobutamine. Beta-2 agonist. You can now remember beta-1 agonist, heart. Beta-2 agonist, bronchial. So these are asthma drugs. Asthma drugs. This is heart, hypotensive drug. Whenever your blood pressure is not controlled, low blood pressure, then we can use dobutamine. Dobutamine. Beta-2 agonist, salbutamol, asthma. Terbutaline, asthma. Salmeterol, new drugs. Famotidol, formoterol. All these are asthma drugs. Then non-catecholamines. These drugs doesn't have catechol structure. What happened? You can give orally route. Can cross blood-brain barrier. So CNS effects will be brief. Long half-life. Long half-life. Here you see short half-life. Cannot be metabolized by comet and MOA. Here it can be metabolized. Sorry, I didn't mention here. It can be metabolized by comet and MOA. Alpha-1 agonists. Alpha-1 agonist. Semen. Here, what happened? All these drugs have catechol ring, but specific beta 1 agonist and beta 2 agonist. These are non-specific drugs. Non-specific drugs. Now here, alpha 1 agonist is phenylephrine, oxymetazoline for nasal decongestion. So whenever there is stuffy nose, then we can use this oxymetazoline. Very good drug. Within few minutes, your block will be relieved. Xylometazoline, metaraminal is alpha 1 agonist. See, alpha 1, what happened? Agonist is we get increased BP. Increased BP. Now, alpha 2 agonist. What happened? Alpha 2 agonist by negative feedback mechanism. I told you again, last just 10 minutes back, I told you, whenever adrenaline, noradrenaline, or any agonist bind to alpha 2 agonist, what happened? Blood pressure is decreased. This is alpha 2 agonist. Example, clonidine, aproclonidine, brimonidine, tizanidine, methyl-dopa, guanfacine. These are alpha 2 agonists. Alpha 2 agonists. Now, then you can see indirect acting. Indirect acting. Now, see, these drugs increase adrenergic transmission indirectly. Indirectly by what? Displacing norepinephrine from the storage vesicles. Different ways. Three ways on the receptor. Now, indirect acting drugs, you see, displace, increase the release, or one more mechanism is inhibiting uptake or inhibiting metabolism. Inhibiting metabolism. These are indirect acting drugs. Examples for displacing norepinephrine from storage vesicle, amphetamine. We have studied this. CNS stimulants. We have studied now amphetamine. Last class, methylamphetamine, more active than amphetamine. 1 gram is enough to settle our life. Very costly drug and drug abusing drug. Drug abusing drug. Tyramine. Then inhibiting uptake, tricyclic antidepressants, imipramine, desipramine, cocaine. That also we study. Inhibiting metabolism, MOA inhibitors. MOA inhibitors. Then mixed type is epinephrine, pseudoephedrine. Sorry, ephedrine. Ephedrine and pseudoephedrine are mixed type. It can act at the receptor level or it can act by these mechanisms. That is mixed type. Many drugs are there here. Next you see, all these are other drugs. Other drugs. Benzyl piperazine, cathinone. That also we studied last semester. Methcathinone, cocaine, ephedrine, pseudoephedrine, dexamethasone, methamphetamine, meprotrilene, then MDMA, that is methylene dioxy methamphetamine. All these are drugs which are acting at adrenergic receptors. Adrenergic receptors. So these are other drugs. I directly got all these from the what is it? Wikipedia. That same one I copied and pasted here. So these are other drugs. Then SAR. So students, any doubt till now? Any doubt means you can ask. So what is the structure of adrenaline? You see, functional groups is the blue ring is called as catechol ring. Then alcoholic hydroxyl group, and this is secondary amine. Secondary amine. Now, the important functional group is alcoholic hydroxyl group. This is alcoholic hydroxyl group. How it should be there? It should be in R form or LEVO form. LEVO form. Let me go to the structure. What happens is it now? Clear this. Now you see, when the hydroxyl group is at the top, it is LEVO form or R form. Consider now, if it comes to dextro form, that means what happened? Hydroxyl group to down. Can it interact with the receptor, with the aspartate, arginine? Sorry, ASN means arginine. Asparagine, sorry, this is asparagine, amino acid asparagine. Asparagine. Now, if it comes to dextro form, it cannot form hydrogen bonding. It cannot form hydrogen bonding. That's why this secondary alcohol, this is secondary alcohol. This secondary alcohol should be in LEVO form. Asparagine, ASPAR, asparagine. Asparagine is the amino acid. ASN is abbreviation. This is aspartic. Serine amino acid. Serine. Phenylalanine. So this is it cannot form. That's why hydroxyl group. Hydroxyl group. See, alcoholic hydroxyl group. It should be LEVO enantiomer is more active. That is R enantiomer or LEVO. Or LEVO is represented by minus. Dextro means plus. Then secondary amine. This is secondary amine, which gets ionized at the physiological pH. Why ionization is important? To form ionic bonding. Please recollect what we have shown the figure. Then catechol ring, intact catechol ring system is intact. This catechol ring is also important. There are some drugs without catechol is also showing activity, but no substitution. Catechol, you cannot substitute at second position again. Let me do, there is some animation here. Oh, this is it. Then 2 to 3 atom distance between catechol ring and amine group, 2 carbon atoms. That means ethyl group is necessary. Otherwise, for binding of interactions is not possible. So this is it. This is now. So noradrenaline is neurotransmitter. Adrenaline is hormone. Both adrenaline, noradrenaline activates all the adrenergic receptors. Activate all the adrenergic receptors. But this is alpha receptor more. Compare. This is more to beta receptor. More. That's what I'm telling. Activates all the adrenergic receptor. No selectivity. No selectivity. Now, adrenaline is used for severe anaphylactic shock. Whenever there is Anaphylactic shock means life-threatening. The symptoms are bronchoconstriction. Like your bronchioles are constricted whenever you have allergic reactions. For example, anaphylactic shock, I can give penicillin drug. Penicillin drug is not suitable for all the people. So before giving, doctor or nurse or pharmacist will ask you whether it is suitable for your body or not. So to check the drug sensitivity, drug is given by intradermal. Drug is given to intradermal on the dermis spot. So a small 1 ml drug is injected to dermis. If you have histamine-like actions, that is flush, flare, irritation, flush, flare, one more, I forgot. These symptoms, histamine symptoms, flush, flare, and redness, then you are allergic for the penicillins. Without checking drug sensitivity, for such people, if you give no, it is life-threatening. Sometimes you may even die if not treated. Your bronchioles will be constricted, no breathing is possible, and shock, all the blood vessels are constricted, shock, all the no blood supply will come. In that conditions, we can use adrenaline. Why? You see, fast acting, it's very fast, but short acting, very short acting. At the same time, now the drug is also having cardiovascular effects. What was the problem? The problem was related to bronchioles, but it is also showing effect on the heart. Or the heart. So there is no specificity here. No specificity. So there is problem. Now our story will go again. Why we selectivity? Selectivity we will go one by one. It is continuation to the SAR. Clear? Any doubt, please? Okay, no problem. People are not responding. No. Now, you see, the naturally occurring, I represented Na means noradrenaline or noradrenaline, A means adrenaline. The naturally occurring noradrenaline, adrenaline has catechol ring, that is 3,4-hydroxybenzene, 3,4-dihydroxybenzene ring. Active at both alpha beta receptor. That means these two drugs are active at both alpha and beta receptor, but has poor oral activity. Poor oral activity because of rapid metabolism by comet. What do you mean by comet? Here I written catechol ortho-methyl transferase. This is the reaction. So this is adrenaline. When reacts with comet, what happened? A methoxy group is formed at 3'. This is ortho-methyl adrenaline, which doesn't have activity. So what is the changes they done is they have removed this catechol ring to different ring. See, this is, you see, here is 3'4 hydroxyl group. Now what happened? We changed to 3'5 methoxy group. Now this drug, which is called as metaproterenol or RC-prenyline, good oral activity. Good oral activity because it is resistant to metabolism by comet. So this is the this is advantage with metaproterenol or RC-proterenol. metaproterenol or RC-proterenol. Now you see, if there is if there is only 3-hydroxyl group and the catechol ring, produce selectivity to alpha receptor or alpha receptor. If there is only hydroxyl group, one hydroxyl group or the 3-, then it produces alpha receptors. Phenylephrine, metaraminal. So now you can see it. There is one more, you see, tertiary butyl group. Tertiary butyl group is placed here, having imidazole ring structure. Imidazole ring structure, which is also oxymetazole. Oxymetazole, which is also acting at the alpha receptor presence in the nasal cavity for stuffy nose and like that, which I was discussing. Oxymetazole. Now, what's the use of metaraminal is indicated for prevention and treatment of acute hypotension state, where whenever you get spinal anesthesia, when you give surgical procedures will not know hypotension, then we can use metaraminal. It is also indicated as an adjuvant treatment of hypotension due to hemorrhage, reaction to medication and surgical complications, shock associated with brain damage due to trauma or tumor. In that conditions, metaraminal can be used. These two drugs are used for stuffy nose. Now, see, now slowly drugs are coming to selectivity. Alpha receptor. Now, beta receptors are present in heart and bronchioles. Unnecessarily, if drug is non-selective, what happens? Your heart rate is increased. Suppose if you are suffering from hypertension, still more you may die. That's why selectivity is very, very important. This is how we are getting it. Now, selectivity between alpha and beta receptor. Selectivity between alpha and beta receptor. Now, we want to differentiate between alpha and beta receptor. How do you differentiate? Is that you add a bulky groups here. Bulky groups. Now the drug will interact with the beta receptor.
Alpha receptor.
Beta receptor. Now again here in beta receptor, two types, beta 1, beta 2. We will see that also, how this selectivity is there. Now, isoprenyl, this is one drug. You see, it is having catechol ring structure, same like adrenaline. Same like adrenaline, but instead of methyl group, there is isopropyl group here. That's why isoprenyline. Isopropyl group is present, so isoprenyline. So what is advantage with this drug? Shows more selectivity to beta. Small b I written, don't worry. It is beta adrenergic receptor. So now this drug is selective, more selective to adrenergic because of, if you can remember, I have placed both alpha receptor and beta receptor structure. Beta receptor has hydrophobic pocket. Now this hydrophobic pocket. This isopropyl group can go and bind to that hydrophobic pocket. Whereas alpha receptor, it cannot enter. There is no hydrophobic pocket. It cannot go and fit there. So the bulky isopropyl group introduces beta selectivity. But what's the problem now here? No selectivity for beta receptor, that is beta 1 and beta. So there is cardiovascular issues. There is cardiovascular issues with this drug. Now, these results indicate that beta receptor has hydrophobic pocket into which a bulky group can fit into it, whereas alpha receptor lacks that bulky group, that hydrophobic pocket. This is the structure. Let us go to, remember the structure, and I will take you to back to that slide. This is isopropyl group, isoprenyline group. Isoprenyline group. This is the hydrophobic functional group, isopropyl group, which can bind to that. Now, if the polar group, like phenol group, you see this group one, is placed at the end of alkyl group, the activity is increased to beta 1 receptor. Slowly we are coming to the beta differentiation between beta 1 and beta 2. See, we have seen alpha. Alpha means alpha 1. We are not studying about alpha 2. If you study alpha 2, is that we are going to study in antihypertensive drugs. In antihypertensive drugs, we will study. Now we are coming differentiation between beta 1 and beta 2. Now, beta 2. This is dobutamine. Dobutamine. Now, dobutamine is also having catechol ring. On amine group, there is there is, you see, butyl hydroxy, phenyl hydroxy group. Hydroxy phenyl butyl group. 1, 2, 3, 4. Butyl group. Butyl. This is called as dobutamine drug. It is selective beta 1 receptor agonist. What is the action, you see? It is positive ionotropic drug. Ionotropic means increased force of contraction. When heart is not pumping, not able to pump, then we can use this drug. Then positive chronotropic drug. Chronotropic, increase heart rate. Ionotropic means increase force of contractions. Positive chronotropic means heart rate. In the spelling, you see HR. HR for heart rate, you can take. Ionotropic means ions. So calcium, it increases. When calcium is increased, what happens to heart pump? Increased. Force of contraction. Now the drug, you see, one more good, vasoconstriction, action on blood vessel, constriction. So by all these, whenever you are suffering from cardiogenic shock, or congestive heart failure, congestive cardiac failure, then this is very, very good drug, dobutamine. So one more thing you need to remember, whenever you have heart problems, one drug will not suitable. They need, you will be given multiple drugs, nearly 10 tablets or 8 tablets. More than 5 tablets you need to take for each session. Morning session and evening, afternoon. you need to take. I'm telling with congestive heart failure, you need to take diuretic, you need to take dopamine, you need to take blood thinners. You need to take about hypertension drug. Oh my God, you need to take some drugs for kidney. Many drugs we need to take for heart problems. So students, any doubt here? Okay. I'm not giving any break. Let us see. Now, beta-2 agonist. Beta-2 agonist. Now, there is only one drug for beta-1 receptor. Adrenaline we can give. We can also use dopamine. We can also use dobutamine. So 3 drugs are there. Whenever you get hypovolemic shock, you can give these drugs. Now, selectivity. Beta-2 receptor. See, the most useful, remember, please listen, the most useful adrenergic agonist, adrenergic than dobutamine, frequently used drugs are beta-2 agonist. Which drugs are used? Not beta-1 agonist. Beta-1 agonists are used whenever you are in dangerous, last stage. Last stage of life. Then we can use beta-1 agonists. Beta-2 agonists are more frequently used medicines. Asthma. Let us see. The most useful adrenergic agonist in the medicine. Adrenergic agonist, I'm telling. Adrenergic agonist that includes both beta-1 and beta-2 in the medicine is to treat asthma, and it is also used as tocolytic. Tocolytic. For some people, no, premature delivery occurs. 7 normal delivery, it takes 9 months. 9 months plus 7 days, something like that. It depends upon person to person. For some people, in the 5th month, they may get delivered. 6th month, they may get delivered. So there is chance of death of baby. So to prevent that, we can use this drug. The medical term for that is called as tocolytics. Drugs which prevent premature labor. See, drugs you give even after 9 months. If baby want to stay with mother, doctors will not keep quiet. They give one drug called as oxytocin. Oxytocin. What they do? They expel uterine content. That means the baby, whatever is present, will come out. Whereas these tocolytics will make the baby to stay in the womb. Will make the baby to stay in the womb. So oxytocin and tocolytics are opposite. Tocolytics, oxytocin, what they do? They expel the contents of uterus. Contents of uterus. So whereas tocolytic prevent that expelling. Suppose if the baby, you are getting pains in the 5th month, very dangerous. There is, all the organs cannot be grown, all the organs will not be well developed. So there is 100% chance of death. Then to prevent that pains, premature delivery, we give drugs called as tocolytics. These drugs we give. The medical term for premature delivery preventing drugs are called as tocolytics. Any doubt, please, Donald Ogolo?
No doubt.
Okay, these drugs. Now, so when we are taking as medical use, let us first consider as adrenaline. We can use adrenaline, but what's the problem? Short duration of action. It was short duration. And non-selectivity. You can act at alpha receptor as well as beta receptor. So you are getting cardiovascular effects. Cardiovascular effects. So to increase selectivity, adrenaline has been replaced by isoprenaline. Just now, whatever we discussed now, isopropyl group on the nitrogen, then it's isoprenaline. But what is the issue with this drug? Non-selectivity between beta 1 and beta receptor. Non-selectivity. So they want selectivity. So for that, what they done, you see, let us further research was carried out to find out selective beta 2 agonist. So what they done is that introduction of alkyl substituent on the side chain. Here you see, in isopropyl group, there is no substitution here. So they introduce a functional group. Ethyl group they introduced on the side chain. Introduced alkyl substituent on the side chain linkage. That is between aromatic ring and amine. The name of drug what resulted is isoethylene. Isoethylene. I am wiping off all this. You see here, isoethylene. This drug. It was good. But what was the problem with this is that it was metabolizing again with. It was protected by MOA. See here also. It is protected by MOA because of isopropyl group. But steric hindrance, it is protected by MOA enzyme. But it is metabolized by comet. So you are getting methyl group. So this is inactive metabolite. So this was the problem with isoethylene. So further research was carried out. So what is the what they done? Let us see next slide. So it is like SAR. So replacement of hydroxyl group, introduction of ethyl group here. Increased activity, but it was metabolized by comet. Isopropyl ethyl group now is to prevent from comet. Comet means catechol orthomethyl transferase. The 3-hydroxyl group has been replaced by carboxylic group, amide group, ester group, a methyl sulfonyl group. They tried them one by one. None were proven to be worthy, but it was successful with hydroxymethyl group or hydroxymethylene group. So this is a hydroxymethylene group, which we got salbutamol, which is very good. The trade name for salbutamol is albuterol for asthma. So the introduction of this drug salbutamol has saved many lives. It was game changer in the treatment of asthma. From salbutamol, they got many drugs. And remember one more thing. Asthma is very resistant drug, very resistant disease. It cannot be treated so easily, but it was good drug. So you get resistance over a period of time when you use salbutamol. So best thing is that apart from drugs, you need to do some breathing exercises. Take forcefully inspiration and expiration. Then only your asthma will be cleared. Otherwise, you ask the people who are suffering from asthma, they will tell their life is threatened. Difficulty in breathing. Oxygen is freely available in the nature, but it is difficult. Continuous cough. Suppose if now you are getting asthma, you can't differentiate between COVID and asthma. So this is the students, you need to get this. Now you can see it and what is the difference and how. Oh my God. No. See, hydroxymethylene group was introduced. So one more thing here, instead of isopropyl group, they have introduced butyl group. Tertiary butyl group they introduced. So still more protection from MOA enzyme and catechol orthomethyl enzyme format. Both ways it is protected. And it has more potency as isoprene. It has same potency. Sorry, you can see it has same potency as isoprene, but what is advantage is 200 times more affinity towards beta 2 receptor. You can see it how many times more selectivity, affinity. Affinity means selectivity towards beta receptor. So there is no cardiovascular issues. Suppose if a patient is suffering from hypertension and asthma, you are suffering. If you don't give selective drugs, then this is very hell. It interacts with heart receptor and increase heart rate, and it interacts with asthma bronchioles and dilates. So that's why the selectivity concept has come. So you may think that why the companies want to waste 15 years, nearly we have seen last time, nearly 10 to 12 years is utilized for one drug to come into the market. $1.5 billion is invested for research. Now you see how many lives can be saved, how much of money you get after research. This is the why lot of money and time is invested to get one drug into the market. Selectivity. Now, furthermore, you see, salmeterol still more good drug. Like like dobutamine, they introduced same dobutamine concept. Hydroxyphenyl butyl group they introduced. Still more bulky group with small hydroxyl group. Bulky group and small hydroxyl group. This no hydroxyl group, it can form hydrogen bond. So replacement of tertiary butyl group with aryl, this is aryl alkyl group, produced a drug with 1.5 times more active and long duration of action than salbutamol. The name of drug is called as salmeterol. 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 So this is the advantage of this drug. And it is also having, see, hydroxymethylene group. Hydroxymethylene group is present. So it can also be protected by COMET. It is also protected by the COMET enzyme. So hope you people are following me. Be attentive, please. It may be boring. So tertiary butyl group. Now, still more big drug. You see? So this is salmeterol. Now this is salmeterol. Salmeterol. You see? They have this portion is related. All this is due to research of salmeterol. Now they introduced hydrophobic group. Still one more hydrophobic on small polar group. Salmeterol. Introduction of long chain hydrocarbon and nitrogen has produced more potent drug called salmeterol. What is the advantage? Long acting, 12 hours. It is used for nocturnal asthma. Usually asthma comes early morning, 3 o'clock, 3 to 4. The child or person will get up continuously cough. Or sometimes night time you get. This is called as nocturnal asthma. Why it is active, long acting? You see lipid solubility. Bind more strongly to the tissues, vicinity to the receptor. And it is 2 times more active than salbutamol. 2 times more active than salbutamol. So that's why I was telling, if beta-adrenergic drugs, any use means what I told, it is in the medicine, you see, most useful adrenergic agonist in the medicine is to treat asthma. And as well as tocolytic. Tocolytics are very rare. Very few people, women may get. You compare, asthma can be for both sex, whereas tocolytics only for female. In 100 females, 1 or 2 females may suffer for premature delivery. There are many reasons for that. So this isn't. So that's why I'm telling for asthma, beta-adrenergic agonist use is asthma. Repeatedly I'm telling. So salbutamol, isoethylene first, but what disadvantage was comet. Then introduction of hydroxymethylene group salbutamol, same potent with that of isoprene, but affinity 2,000 times. Then 1.5 times more active salmeterol, like dobutamine. No. This is more potent, 2 times. Salmeterol was 1.5 times, whereas this is 2 times more active than salbutamol. Then one more drug. You see, many drugs are there. Only few drugs I have introduced. Bisoltirol. Bisoltirol is pro-drug. Is a pro-drug with beta-selective adrenergic agonist. The beta-selective adrenergic steroid. On metabolism, it is converted to cholesterol. So this is, you see, this is cholesterol. So this is bisoltirol. Bisoltirol is a prodrug and it has an ester group in its structure. You see an ester group. So it can be prevented by comet ester group. Methyl group it cannot transfer. So and isobutyl group is present. Butyl group is present. Tertiary butyl group is present. Sorry. Esterases present in the drug will metabolize to give the drug cholesterol and parabutylic acid. Oh my God. Sorry, paratolic acid. What is this group? Toluene. Benzene with methyl group is toluene. If it is attached with carboxylic group, is called as toluic acid. Toluene, toluic acid. The presence of two toluic acid esters. This toluic acid esters in butyl make it more lipophilic in nature and good in action. So indirectly here, you have studied about cholesterol drug as well as butyl. Slowly it will be released and it will show the action. Now this drug can be metabolized by comet. It can be metabolized by comet. Any doubt, please?
I have a question.
Please, madam.
Why are you saying the butyl is protected by comets and cholesterol is not? Not gotten that part.
Please repeat again.
Why are you saying butyl is protected from comet, the COMT, but cholesterol is not protected?
Please observe the structure. It is already with big bulky group here. That is toluic acid is esterified. So when you get already bulky groups are there, so you cannot get metabolized by comet. But on metabolism, what happened now? You got free hydroxyl group. Catechol ring is formed again. Yes or no? Keribu. OBT.
It's the free hydroxyl group.
Here it is the free hydroxyl group. That's what I was telling. It's a prodrug, and it is by the esterases enzymes in the lungs slowly releases to cholesterol drug. If you take cholesterol drug, it gets metabolized. So in order to avoid that, the drug is given in the form of butyl. Bitolterol, it's an ester of two molecules of toluic acid and cholesterol. If you take alone this drug, then it cannot be active. Not effective. It can produce bronchodilation effect, but not effective as butyl. Now, any doubt, please? Clear? Ugiti?
Yeah.
Then one more is terbutaline. This is also very good drug. Terbutaline. Very cheap drug, again I'm telling. Most of this drug again are given by what is that? Inhalation process. By what is that? I forgot that instrument. Inhalation process directly by what is that? There is one instrument.
Inhaler.
Inhalers. Not inhalers. I'll show you that. But this drug is given by IV route of injection. When I was doing training, I got acquainted with this drug. They used to prescribe this drug for asthma people like anything. But short duration of action. So, tertiary butyl group in terbutaline. And you see, no, it's not having catechol ring. Make it more selective for beta-2 receptor, that we know that. Since there is no hydroxyl group on fourth position of benzene ring, the molecule is less susceptible to enzyme catechol orthomethyl transferase. Orthomethyl transferase. Now, terbutaline contains stereocenter and consists of two enantiomers racemate, that is 1:1 mixture is given, racemic form is given. Terbutaline is used as a fast-acting bronchodilator. So I also observed the patient used to get relief very within 5 minutes. Previously, when they visit hospital, they were telling like that they will be breathing and very difficult in breathing. With mouth they used to take. Now after taking, no, they'll be very relaxed. Fast-acting bronchodilator. Often used as a short-term asthma treatment. That's what. But asthma used as tocolyte for delay premature labor. This also can be used for tocolytics. It is inhaled. The inhaled form of terbutaline start working within 15 minutes and can last for 6 hours. This is about terbutaline. This is also very good drug. Now you see the alkyl substitution. Let us, what we will do is that it's 4:35. Take a 10 minutes break. 10:30, 4:35, 4:45. We'll come back. Take 10 minutes break. Take some tea, coffee, or something, and come back. Okay. I'm closing the video and audio. Now, children, here this is ephedrine, and this is norepinephrine. Norepinephrine. Sir, what do you mean by nor? Without methyl group. So there is no methyl group here. So this is norepinephrine. This is this drug, methylephedrine. See, extra methyl group is present than in ephedrine. So it is called as methylephedrine. Now, this is a structure of amphetamine. The another name for norepinephrine is beta-hydroxy amphetamine. This is alpha carbon, this is beta carbon. So beta-hydroxy amphetamine. If you observe all these structures, there is no catechol ring. There is no catechol ring here. And there is alkyl substitution on the side chain. Alkyl substitution on the side chain. So alkyl substitution on the side chain, especially at the C2, on the C2, and there is one more methyl group at amine group, decreases MOA activity. And removal of catechol ring decreases the metabolism of comet. And these drugs, now what happens is, because of decreased hydroxyl group, there is decreased polarity. They can produce CNS effects. So that's why ephedrine, amphetamine, methylephedrine, they produce CNS effects. They produce CNS effects. Amphetamine, CNS stimulation. This also stimulation effect we get. What's the reason? There is no catechol ring in it. And the substitution, whatever is present on methyl group and alpha carbon, will prevent metabolism. So this is it regarding this drug. Now, mechanism of action. There are different types of mechanism. So one slide for each alpha receptor. Then we will see the activities. So we have already studied all these. Then uses, one synthesis. We will close the session. So let us see. So let me go for one more time. You can see it. And so this is the structure of adrenaline. 2 minutes. We will revise everything what we studied. So first we studied different parts. Tertiary, so secondary amine, then tertiary alcohol group, what is it? Alcoholic group, then catechol ring. Alcohol group. Then we told that this hydroxyl group should be at R position or levorotatory. Then only it can interact with the alpha with adrenergic receptors. Adrenaline cannot differentiate alpha beta, but more active towards beta receptor. So if hydroxyl group is below the plane, it becomes dextro and it cannot bind to the receptor. I have shown the figure. Then the secondary amine in the body gets to quaternary nitrogen, which can interact with ionic bonding. Sorry. Next, catechol ring can form hydrogen bonding with serine 207, 204, I think. This is a catechol ring. What is disadvantage with this adrenaline is that it cannot differentiate between alpha receptor and beta receptor. Beta receptor. So now, so this is an adrenaline is very good drug which is used for anaphylactic shock. I mentioned about penicillin, one example for anaphylactic shock. Where very fatality occurs if not treated. Then we discussed about why adrenaline is not only the non-specific, it gets metabolized very easily by comet as well as MOA inhibitor. We have seen the metabolism, please refer to that. So in order to avoid that, what happened? They replaced one of its hydroxyl group from 3' to 4' hydroxyl group to 3' to 5', which is resulted metaproterenol or RC-prenylene. Some textbooks mentions as metaproterenol, some mention as RC-prenylene. Both are same. Please take care. Please note down this. Note down this. Now, next we have seen about only one hydroxyl group is present, then it is acting at alpha receptor. One exception is that oxymetazoline, which is having tertiary butyl group as well as this imidazole ring. It doesn't have any free nitrogen. Nitrogen is in imidazole form. Very good drug for both these drugs. Phenylephrine and oxymetazoline is used for stuffy nose. Metaproterenol is used for treatment of hypotension in brain damage due to trauma or even due to tumor. Tumor. This is very good drug for maintaining blood pressure whenever you take surgical anesthesia. In spinal anesthesia, if any complications occur, metaproterenol is injected very fast to increase blood pressure, to get it to the normal level. Next, isoprenaline. With the introduction of isopropyl group and the amine group, it has resulted differentiation between alpha and beta receptor. Now this isoprenaline is more beta selective. That's why, because it is able to interact with the hydrophobic pocket present in the beta receptor. But what is the issue? It is not differentiating between beta 1 and beta 2 receptor. I was telling that if a patient is suffering from asthma and hypertension, then the real story comes on. There the selectivity suffers, because nowadays many patients are suffering multiple diseases at a time. If you get diabetes, free diseases, eye problem you will get, what is it, nerve problems, you will get kidney problem. All diseases are free because of diabetes. So it is worst disease in life, and every disease is worst, but diabetes is very worst disease. So try to protect yourself. It's a metabolic disorder. In the same way, if you get asthma and heart problem, hypertension and asthma, then it is not suitable to take a drug which is non-selective. Next, we have seen dobutamine, where hydroxyphenyl butyl group is attached to the amine group. Then this is beta 1 selective drug. It increases chronotropic, inotropic drug. Force of contraction and force of heart rate is increased. It is very good drug for cardiogenic shock. Cardiogenic shock and congestive heart failure. We will study once again in congestive heart failure disease. Very good drug. Now, then we have studied about beta agonists. Again, we have taken adrenaline, like the starting, like I told, one by one. Isoprenaline was taken, then ethyl group was added on the side chain on the beta carbon, on the alpha carbon. Then it was very good, but it was metabolized by comet. Then we got salbutamol. Salbutamol resulted in many drugs. Salmifemol. See, all the drugs are having salbutamol structure. It has tertiary butyl group. It is 200 times more affinity towards beta 2 receptor. Then same like salbutamol, dobutamide. If you introduce hydroxyphenyl butyl group, we get salmifemol, which is 1.5 times more potent than salbutamol. Then salmifemol, hydrophobic and hydrophilic and lipopolar functional group is introduced. Lengthy, because of these hydrophobic groups, it is very long acting, 12 hours. That's why it is used for nocturnal asthma. It is 2 times more potent. Then one drug we studied about, bitalterol, which is a prodrug. Toluic acid is esterified with isoprenaline. Isoprenaline. Isoprenaline is butyl group, no? Coltirol, sorry. Isoprenaline means like this. It is esterified with coltirol. It is also good drug. Next is terbutaline. Very good fast acting drug. Fast acting drug, terbutaline. Then we have seen centrally acting drugs, ephedrine, amphetamine, methylephedrine, norepinephrine, beta hydroxyamphetamine. Why? Because the polarity hydroxyl group are removed, so there is no chance of metabolizing by comet, and also it is prevented by MOA by methyl group present at the beta carbon. Beta carbon. So because of all these, no, it is acting centrally acting drugs. Then this we have studied. Now mechanism of action. Now at alpha-1 receptor, it is G-protein. Adrenergic receptors are G-protein coupled receptor. Alpha-1 receptor. These drugs are agonists. Which drugs? Whatever we studied till now. At alpha receptor, it is G-protein coupled receptor. It is GQ protein. So there are G-protein, you might have studied GS, GI, and GQ protein. You might have studied this one. The G-protein coupled receptor is subdivided like this, depending upon the substrate. For GQ protein, the substrate is PIP2. PIP2, that is phosphatidyl inositol diphosphate. I will type on. When I will resubmit again. You can read it. Or you might have studied, I guess, in pharmacology. PIP2 means phosphatidyl inositol diphosphate. Phosphatidyl inositol diphosphate. By the help of enzyme phospholipase, 2 phosphate molecules will be removed. You will get IP3, inositol triphosphate, and DG, diacetyl glycerol. And these are the secondary messengers. These are the secondary messengers which carry the action. So what happens is, you see IP3, inositol triphosphate, increase calcium concentration. Calcium concentration. So when calcium is increased, what happens? Contraction occurs. So there is contraction of smooth muscles and cardiac muscles. Contraction occurs. Increased secretion of endocrine glands. And one more thing, DG, diacetylglycerol, also stimulate protein kinases. Protein kinase C. Now, increased production of adrenaline. Increased production of adrenaline in suprarenal gland increased. And further increases in the liver, you see glyconeogenesis, glycogenolysis, fatty acid synthesis, relaxed uterine smooth muscles. All these activities are occurred because of alpha-1 receptor. Alpha-1 receptor is GQ protein. What are the substrate for this? Is phosphatidyl inositol diphosphate. It results in IP3 and DG. Because of these 2 secondary messengers, you get all these activities. Now, let us see at alpha-2 receptor. Where is alpha-2 receptors is present? It is present in preganglionic nerve. It is present in the preganglionic nerve fiber, presynaptic nerve fiber of medulla oblongata, alpha-2. Now, these receptors are present in presynaptic nerve fiber of medulla oblongata, alpha-2. It is GI protein. It is also coupled receptor, GI protein. Now, see here, GI protein is completely opposite to GS protein. S means stimulation, I means inhibition. G means G protein coupled receptor. I implicates for inhibitory effect. S for stimulatory effect. The substrate for both this GI and GS is ATP, adenosine triphosphate. Now, ATP is converted to cyclic AMP. We studied this type of mechanism in what is that? Caffeine. CNS stimulants we studied. If you can refer, you can see it. ATP is converted to adenyl cyclase. See the name of enzyme, you see, ATP means adenosine. For adenosine, there is cyclase ring is formed. That is cyclic AMP, which is active. If it is GS protein, cyclic AMP levels are increased. Cyclic levels are increased because of alpha-2 receptor is here. Please remember, it is all we are discussing about alpha-2 receptor. Alpha receptor is GI protein. So cyclic AMP levels are decreased. When cyclic AMP levels are decreased, calcium is decreased. If you can remember, even in caffeine, it produces bronchodilation, we told. Fresh thoughts of, fresh flow of thoughts we get. Why? Because of increased calcium levels. Now here, calcium is decreased. So vasodilation occurs. That's why alpha-2 receptors are antihypertensive drugs. Anti-BP drugs, I was telling, are antihypertensive drugs. Hypertensive drugs. Because why? Vasodilation. Oh, very good antihypertensive drugs. Examples of drugs: methyl dopa, clonidine. These two drugs are prescribed more. Methyl dopa, clonidine. This we have studied in the synthesis of synthesis of adrenaline. Negative symbol I have shown. You remember that. Now this is about alpha-2 receptor. That's why it is antihypertensive drug because of GI protein. Now beta-1 receptor. It is GS protein. Stimulatory effect. It converts ATP to cyclic AMP. It is stimulatory in nature. So increase intracellular calcium. Stimulates heart. Release renin in kidney. Release renin in kidney. So vasoconstriction occurs. Vasoconstriction occurs. Even beta-2 receptor is GI protein. So cyclic AMP levels are decreased. So cyclic calcium levels are relaxed. So when there is decreased calcium, bronchioles. So you see vasodilation of blood vessels, bronchioles, dilation, uterine muscles are also relaxed. This is why, that's why a single neurotransmitter, when it binds to different parts, it is having multiple actions. Once it is showing increased heart rate, others it is showing vasodilation, uterine dilation, bronchioles dilation. Why? It is acting at different sites. Different sites. For example, you also, in front of me, you may behave very well. In front of your friends, you may be mischievous. Same way like that, a drug will bind to different parts, different receptors, and shows different activities. Different activities. I hope you understood. Now, still, now, why I am telling all this? No, if I tell all this, no, I will. This is pharmacology. In when I'm studying, when I'm making you to study antihypertensives, the mechanism of actions and everything will be very easy for me. You please get acquainted with these terms. Positive chronotropic. I told you in the spelling, HR means increased heart rate. Negative inotropic means decreased heart rate. Positive means increase heart rate, increase heart rate. Positive dronotropic is a new term we didn't study. Drono means increase conduction. Increase conduction. That means from SA node to AV node to bundle of his to Purkinje fibers, then to ventricles. That signal movement increases. That is called as dronotropic. Then positive inotropic, ions, movement of ions. For you consider calcium here. Calcium. So increased calcium levels, increase heart rate, increase force of contraction. Sorry, force of contraction. So these are the what is that? Actions on cardiovascular effect. Positive, positive chronotropic, dronotropic, and inotropic. All these drugs, adrenaline, especially adrenaline, dopamine, dobutamine. Dobutamine. Now, blood vessels at alpha-1 receptor. What happens? This is normal blood vessel, you see. When adrenaline binds to it, it causes dilation. Alpha-1 receptor is present in on the blood vessel. So, vasoconstriction occurs. That's why we used in treatment of hypotension. Hypotension. Now, all our antihypertensive drugs will cause reverse. I was telling renin, no. Renin, what it does, it causes vasoconstriction. It causes vasoconstriction. All our antihypertensive drugs cause dilation. Because of stress, over release of adrenaline, blood vessel diameter decreases. Diameter of the blood vessel decreases. Like this, it becomes for age. But our antihypertensives will cause this, increase the diameter. So that's why I am repeatedly telling these pharmacological actions. Then, sorry, action on respiratory system. B2 receptors are available at the respiratory system. So bronchioles are dilated. So that's why we get rapid, powerful relaxation. That is nothing but bronchodilation. So used in treatment of asthma. Then action on eye, mydriatic effect. Same like atropine. Atropine. If you can see it, no, most of its actions are nothing but anticholinergic actions. Then action on GIT, peristalsis is reduced, sphincters are contracted. If you can see the first slide, I told you, parasympathetic nervous system activate whenever you are in peace and digestion. This is for flight or fight hormone. If your body is digesting, no, energy is utilized for digestion. You can't run, you can't escape. That's why. Then action on deuter relaxed, sphincters are contracted. So urinary retention, like anti cholinergic drugs. Like tolterodine, we studied tolterodine, that like that. Now, okay. Now, adrenergic receptor, physiological effect at alpha 1, alpha 2. Alpha 1, vasoconstriction, increase peripheral resistance, increase BP, mydriasis, closure of sphincters. Alpha 2, what happened? Decrease norepinephrine release, decrease insulin release. We are going to finish. Wait, please. Beta 1 on heart, tachycardia, increase heart rate. Beta 2, no action on heart and bronchodilation, lipolysis occur, mydriatic myocardial contraction occurs. Increase muscle and liver glyconeogenesis, genolysis, relax, increase release of glucagon, and relaxed uterine smooth muscles. Uterine smooth muscles. That's why beta 2 tocolytics. Tocolytics. Then uses of adrenaline is A, B, C, D, E, G. A for anaphylactic shock, B for bronchial asthma. See, now if you tell what's the use, tell few drugs of asthma treatment. Nowadays, if you tell adrenal means not good, and there are better drugs. Better drugs. If they are asking what are the uses of adrenal means, you can tell this. If they ask, give some drugs used in asthma means, you should start with salbutamol, salmeterol, salmifemol, colterol, like that, not with adrenaline. I was teaching when I was teaching in India, no? I was also teaching for nursing, pharmacology. The students used to fail in pharmacology. Then I asked them, why you are failing? Please tell me. So if when I give an exam, write few drugs of what is that? Asthma means they have written about adrenaline, not about salbutamol, salmeterol. That's why they were failing. Then I corrected them. The results were improved. So this is one classic examples. Nowadays, no better drugs are available. For example, if you want, what are the drugs used in treatment of glaucoma? You should start with pilocarpine, next carbachol, like that. Don't start with acetylcholine. No. You need to write the answers correctly. Like no. Bronchial asthma, cardiac arrest. Then delayed absorption of local anesthetics. This also we have studied. Local anesthetics are combined with adrenaline, we told. You remember that. Refer again. Adrenaline, what it causes? It causes vasoconstriction. Vasoconstriction. You see here, this is the picture. You see blood vessel, vasoconstriction. So slowly drug is released. Which one? Local anesthetic. So its activity increased. Then epitoxis. Epitoxis means bleeding from nose. For some people, for unknown reason, they get bleed from the nose. That is called as epitoxis. Epitoxis. For them it is used. Elevate, even for them, BP is also increased. Then it's also used to treat glaucoma. Glaucoma. Other uses, you see, nasal congestion. In the treatment of congestion, induce mydriasis, and as well as tocolytics. These are the uses of adrenergic drugs. Then adverse effects. You see, If I'm asking, write the uses of adrenaline, start with anaphylactic shock, cardiac arrest, local anesthetic. Last, you write bronchial asthma. This fashion, why I told you, is that easy to remember. A, B, C, D, E, F, G. If not, A, B, C, D, E, G. That's why we have written like this. Then adverse effects, hypertension crisis, arrhythmias, increased heart rate, angina pectoris, hyperglycemia, liver glucose level is increased, and if you can observe, nervousness, then necrosis followed by extravasation. These are the adverse effects of these drugs. Then amphetamine, synthesis of amphetamine. We have studied this. Phenylacetone, phenylacetone. This is acetone group. When treated with ammonia, you get amine group here. Reduction, you get amphetamine. CNS stimulant, I told you in that slide. Why? Because no polar groups. That's why it can able to cross blood-brain barrier. Treat narcolepsy and attention deficient hyperactivity disorder. And it is also appetite suppressant. Appetite suppressant. In obesity, it can be used. Then salbutamol, big synthesis. You can see it. Aspirin is used for synthesis of salbutamol. Now, Fry's rearrangement, if you can recollect, in first year what you studied, this naming reaction in presence of aluminum chloride and nitrobenzene. What happens is that there is internal reaction. You see, no new functional groups will come and react. The acetyl group, which is present here, will travel to para position. This is intramolecule, within the molecule, intermolecule rearrangement reaction. Intermolecular rearrangement reaction. That is, we get a keto acid. Keto, this is keto group. Acid, keto acid. Now esterify with methanol and hydrochloric acid. Even when we have seen synthesis of benzoic acid, we use the same methanol is getting esterified. Now treat with bromine. What happened? New bromine molecule is attached here. Now treat here with phenyl benzyl butylamine. You see butyl, you see benzyl, benzene. That means what? It like this one. This is benzyl amino butyl group. 1, 2, 3, 4. Then this group is attached on the night. Total this group will be attached on the this carbon. Now, in presence of lithium aluminum hydride reduction process, this keto group will be reduced to hydroxyl group. and THF, tetrahydrofuran, will cause deesterification, and you will get OH group. Total reduction. This is reduction process occurs. Then finally, in presence of hydrogen, palladium, and carbon hydrogenolysis, what happens is that this group will be eliminated to get salbutamol, which is racemic mixture. Racemic mixture you will get. This is the synthesis of salbutamol. Multiple steps are there here. Fry's rearrangement. Starting material is aspirin. Then esterification. We are esterifying this. Otherwise, no, without esterification, otherwise this bromine, this if you don't esterify, if you directly react with bromine, what happens is that it can react with carboxylic group. It can react with the carboxylic group. That's why we are esterifying that. So one more thing, if you can observe, we are slowly converting into hydroxyl group, methylene hydroxyl group. That's why we are converting into ester, then finally reducing it in presence of lithium aluminum hydride and tetrahydrofuran. Any doubt, please, here? Another 2 slides, 5:30, please, sir, 2 slides. So what are the uses? You know that it is used as adrenergic bronchodilator. It's a racemic mixture. R enantiomer is 60 times more potent than S enantiomer. Nowadays, no, R enantiomer is available, that is called as levobutotirol. Levobutotirol. Complete. When you are giving a racemic mixture, 68 times active, remaining 22% is inactive, unnecessarily dumping. That's why now FDA, Food Drug Administration, are all the regulatory authorities of countries. For example, in our country, it is PBB. They are stressing on the chiral switching. That is, active isomer you give to the patient. Here you see 68% is active, unnecessarily 20% inactive. So you are paying money for 22%, which is waste. So nowadays, no, regulatory authorities are telling you give active molecule. Such one is called as chiral switching. Chiral switching. This is one important. You can. Now, nasal decongestant. These are nasal decongestant. Xylometazoline, phenylephrine, pseudoephedrine, and oxymetazoline. All these are nasal decongestant. These drugs will be having local purpose. Local purpose. As they are available as nasal spray, nasal sprays. Nasal spray purpose, nasal decongestion. In stuffy nose, you get redness of eye. Tears will be flowing. To avoid that, we can use this nasal decongestant. Xylometazoline. This is xylene. This is xylene structure. Metazoline. tetrabutyl group. Oxymetazoline. Oxymetaxylene. Then phenylephrine, pseudoephedrine. Pseudoephedrine. Pseudoephedrine is one type of ephedrine which doesn't have CNS effects. If you can remember, I told you ephedrine has CNS effects. Please don't leave. Whereas pseudoephedrine is having local effect. It doesn't have CNS effects. Generally, whenever you take drugs for cold, you get CNS depression. But all these drugs will not produce CNS depression. You can take these drugs and go for your work. That time. This is a difference between ephedrine and pseudoephedrine. Here, chirality. Yes. No. See, this is how it causes. So, blood vessel of nasal blood vessel. See, congestion. When you give antagonist, you give agonist, what happens is all this vasoconstriction. Blood vessel will be constricted. The blood vessel in the nasal, white portion is your nose, nostrils, correct. The red one is blood vessels. It gets dilated in the nasal cavity. So there is difficulty in breathing. So fluid comes out. And when you constrict it, what happens is that there is opening of pathway, congestion, decongestion occurs. Previously it was congestion, narrow nasal pathway because of blood vessel dilated. Because of blood vessel dilation. Now here narrows this because of dilation. What happens? Narrows the nasal pathway. So there was congestion, difficulty in breathing. Now, when you give alpha agonist, what happens is that open blood vessel gets constricted. Gives constricted. See, this is plus and not opposite. Plus. So when you give this, what happens? Blood vessels constricted and more pathway for air. So broad nasal pathway. Then here, your nostrils will not get big, and if it gets big, what happened? Beauty is the problem. So it doesn't occur like that. This is I think we finished. This is thank you. Any doubt, please? Students, any doubt? Okay, then. If you don't have doubt, we can leave. And please, one announcement. Eho, Mary, Khalif Hassan, Sylvia, Gracious, and Rashid. We will write exam at 7 p.m. Because it is almost 5:30. 5:30. Here it is 8 o'clock. So let me have some time, eat some food and come on. Inform in your group. I also will inform in group. Bye.
Bye.
Bye-bye. Mary, hey ho. Okay then.